Hi friends, welcome back to my channel Mookambika Nursing. Friends, here in this video we can see important questions for exam and we can see the questions one by one. First question, taste buds for sensing bitterness are located on which part of the tongue? Options are option A, anterior part of the tongue, option B, posterior part of the tongue, option C, lateral part of the tongue, and option D, under surface of the tongue. Taste buds for sensing bitterness are located in which part of the tongue? Okay, that is the question. So correct answer is option B, posterior part of the tongue. It is located on the posterior surface. Bitterness is located in the posterior surface. Option B is the correct answer. The next question, during infancy, which is the most common cause of myocarditis? Options are option A, streptococci, option B, Coxsackie B infection, option C, beta hemolytic streptococci, option D, none of this. And the correct answer is option B, Coxsackie B infection. The most common cause of myocarditis in infancy is Coxsackie B infection. The next question, in spinal cord, myelin sheath is formed by. Options are option A, Schwann cells, option B, oligodendrocytes, option C, osteocytes, and option D, osteoblast. Correct answer is option B, oligodendrocytes. Nerve system includes central nervous system and peripheral nervous system. In central nervous system, the myelin sheath is formed by oligodendrocytes, and in peripheral nervous system, the myelin sheath is formed by Schwann cells. Okay, here in spinal cord, myelin sheath is formed by oligodendrocytes. Option B is the correct answer. And the next question, a raised flat lesion formed from merging papules or nodules is known as. Options are option A, macule, option B, papule, option D, nodule, and option D, plaque. Correct answer is option D, plaque. Plaque means is a raised flat lesions formed from merging papule or nodule. First option, macule. Macule means the flat patches, that is the skin color, only the skin color is changed in case of macule, that is like a flat patches we can see in case of macule. Papule means is an elevated solid lesion and is less than 1 centimeter in size. Okay, a nodule means it is larger than papule. Papule is an elevated solid lesion and is less than 1 centimeter in size. This nodule means it is larger than papule and this raised solid lesions can extend up to dermis. Here our question answer is option D, plaque. And the next question, elevated thick walled lesions containing fluid or semi-solid matter is known as. Options are option A, macule, option B, papule, option C, cyst, and option D, pustules. Here macule and papule we discussed in the previous question. So we can expect question answer is option C, cyst is an elevated thick walled lesion containing semi-solid matter. Fluid or semi-solid matter is known as cyst. Okay, and option D, pustule is there. Pustule is also an elevated lesion and it is less than 1 centimeter in size and containing purulent material, that is pus forming material, that is known as pustules. The next question is, the newborn maturity rate is assessed by using. Options are option A, New Ballard scale, option B, Braden scale, option C, Payne scale, and option D, none of this. Correct answer is option A, New Ballard scale is used to identify the newborn maturity rate. And the next question, flag sign is a characteristic features of. Options are option A, beriberi, option B, marasmus, option C, kwashiorkor, and option D, anemia. Flag sign is the characteristic features of option C. Kwashiorkor is the correct answer. Flag sign is associated with kwashiorkor. Question, antibiotic sensitivity is usually done by using. Options are option A, McConaughey agar, option B, Muller-Hinton agar, option C, Blood agar, and option D, none of this. Correct answer is option B, Muller-Hinton agar, which is used to identify the antibiotic sensitivity. The next question, Sang's-Smear test is used to diagnose. Options are option A, vaginitis, option B, herpes zoster infection, option C, myocarditis, and option D, psoriasis. Sang's-Smear test, which is used to diagnose, option B, herpes zoster infection. This Sang's-Smear test is a microscopic assessment test which is used to diagnosis of viral infections such as herpes simplex or herpes zoster infection. The next question, Coe-Bonus phenomenon is seen in. Options are option A, dermatitis, option B, psoriasis vulgaris, option C, acne vulgaris, option D, peptic ulcer. Correct answer is option B, psoriasis vulgaris. Coe-Bonus phenomena is associated with psoriasis. The psoriasis vulgaris is a chronic recurrent erythematous inflammatory disorder of the skin. Lesions of psoriasis usually symmetrical in distribution and is commonly occurs in scalp, elbow, knees, genital area and sacral region. This Coe-Bonus phenomena means the lesions may develop the site of injury. Suppose if there is any injury occur, there also the lesions can occur. That is known as Coe-Bonus phenomena. It is seen in psoriasis vulgaris. Option B is the correct answer. The next question, inherited sex-linked bleeding disorder is. Options are option A, hemophilia, option B, thalassemia, option C, sickle cell anemia, and option D, all of this. Correct answer is option A, hemophilia is the inherited sex-linked bleeding disorder. The next question, pain medication of choice in acute myocardial infarction is. Correct answer is option A, pethidine hydrochloride, option B, diclofenac sodium, option C, codeine sulfate, and option D, morphine sulfate. Correct answer is option D, morphine sulfate is the pain medication, first pain medication for myocardial infarction.